Hello aspirants, good morning to all and welcome to SRIRAM's IAS channel. So friends, in today's discussion, let us try to discuss about one invisible emergency that is prevailing in India and not only in India, throughout the world. So that is nothing but mental health crisis. So friends, if you look at the lifestyle of current people, so there are so many anxiety, so much of depression, so much of mental pressures and psychological issues. So people are facing such kind of issues, and these kind of issues, be it could be anxiety, depression, suicidal tendencies are growing on day by day. So such an aspect we are going to deal today, and in this video we are going to understand what is basically mental health and what do we call something that is known as mental health crisis, and how this mental health crisis is prevailing as an invisible emergency. Is that clear? And apart from that, let us try to understand what are the statistics and data that are available with us with respect to the mental health crisis. Okay, so moreover that we are going to watch about some of the important policy gaps that exists in our system. So let's try to know about all such aspects and let's try to dwell more into the topic. So first, let us start by understanding what do you mean by the word mental health. So try to think about this. So mental health. So first, let us try to understand what is mental health. So friends, when we talk from the perspective of the topic mental health, so mental health is basically nothing but, look here, so it's a state of mental well-being. So it's a state of mental well-being more than just the absence of mental disorders. So health is nothing but it's a state of mental well-being rather than mere absence of diseases or disorders. So this is what we call it as mental health. Are you getting that? So then if you look at the next aspect, so what is the basic definition of the mental health? So if we look from the perspective of the definition, so World Health Organization has given a clear-cut definition for the mental health. So let us try to know that definition. So if we look from the perspective of the definition, so you have to use credible definitions. So here you can have that credible definition for mental health. So look here, according to World Health Organization, mental health refers to what? Mental health is nothing but it's a state of well-being. So first and foremost thing that you have to remember is that mental health is a state of well-being. So in which what happens? In which the individual realizes his or her own abilities. So first criteria is that if a person is mentally healthy, so then he has to or she has to realize that her own abilities. So what are my abilities? So that is one thing. Then next thing is that it's a state of well-being in which an individual can cope up with the normal stresses of the life. So there are so many stresses that would be there in our lives. So if a person has to be physically and individually and psychologically fit, so that means he should be ready to cope up with the normal stresses of the life, and then an individual can work productively and fruitfully. So that is another important criteria. And apart from that, an individual is able to make the contribution to his or her community. So if these criteria is met, so then we will call all such aspect as mental health according to WHO. So I hope you are able to catch the thing. So what we can expect under the mental health? So in general fashion, how we can say what is mental health means, in general it encompasses a state of social, emotional as well as psychological well-being of a person. So we have to have social well-being, psychological well-being as well as emotional well-being. So think of all these kind of issues. Anxiety is a psychological issue. So stress is an emotional as well as psychological aspect. So how stress will reach? So usually be it could be from the society or be it could be from the surroundings. So from that point of view, social, emotional as well as psychological well-being of a person would be generally called as mental health. So that's what you have to understand. So now we are using a word mental health crisis. So we have to understand what do you mean by mental health crisis, and what are the various symptoms or what are the various common manifestations of the mental health crisis. So, dear friends, whenever the mental health deteriorates, that means whenever the mental health gets disturbed due to various activities. So, just have a look here. So, mental health crisis refers to it's a state of the society where so many people in the society will face severe psychological, emotional or some sort of mental related issues. So that's one thing. So be it could be the anxiety, be it could be the stress, or be it could be things like a depression, or if everything goes aggravates, and finally having suicidal tendencies. So all these kind of activities together makes up a criteria, makes up a situation that leads to a crisis situation that is known as mental health crisis. So in today's world, the mental health crisis is dominated and it is full of all such kind of issues. So now let us try to understand why this mental health crisis, or why we are discussing about the mental health as an invisible emergency, and why we are proceeding with this particular topic. So let's understand why this particular thing is in news now. So if you look at the perspective of the news, so recently there has been an article published in Hindu, so which was talking about the data that is there with respect to the ADSI, that is the National Crime Records Bureau's accidental deaths and suicides in India. So accidental deaths and suicides in India. So an article has been published on the mental health crisis. So that's why, and on this context, we are understanding this particular concept. Are you getting it? So now, look at. So if you see from the perspective of India, so India is facing a grave mental health crisis that cuts across the reasons, demographics, and professions. So be it could be any profession, be it could be any region, be it could be any place, be it could be anywhere. So we can see a lot of such kind of mental health issues. So anxiety, depression, suicidal tendencies, or all such kind of things are creeping into every realm of the people. So that's one thing we have to remember. So if you look from the perspective of the National Crime Record Bureau's Accidental Deaths and Suicides in India Report 2023, so it has recorded that there was around 1,71,418 suicides which have been reported. So remember, 1,71,000 suicidal deaths. So it's not a small aspect. So try to just look at the severity and gravity of the situation, because these many suicides are there means how many people might have the issue of anxiety, how many people might have the issue of depression, how many people might have the issue of the such kind of depression. So think about all such things. So now it was a marginal rise, if you see 0.3% rise when we see from 2022 data. So day by day, that means year by year, so the issues should go on reduced. But now what has happened? So there was a slight margin of 0.3% in the suicidal activities. So that is one thing. So you might have also recently read in the news that there were so many students, so hailing from the Kota region of Rajasthan, due to psychological pressure, they have committed suicides. Are you aware of this? And not only this, every day in newspaper you will watch that one or other couple or one or other person might be taking away the lives due to stress, due to anxiety, due to depression, all those things. So we are going to discuss about all such kind of statistics and all such kind of data in this particular discussion. So just look at this. So while the suicide rate per lakh population declined slightly, but although it has been declined slightly, but the absolute numbers, look at this, absolute numbers remain very high. So this is underscoring the deep social, economic and psychological crisis in India. So we have to just understand such kind of aspects now. So now you just look at this. So when we see from the perspective of the data and statistics, so if we see from India's perspective, yes, So the mental health crisis in India is a big crisis and it is emerging as an emergency. And if you look at the data and trends, so very simple data that presents and that is there in front of us is, look at this. So 20% of the India suffer from mental health issues. So 20% of the Indians. So let's say, for example, we have in India 1.4 billion members are there, population is there. So out of that, so 20% are suffering with this. So imagine the situation, grave situation. That means 1/5 of the members of the population are having the issue. So that's the gravity of the situation. And apart from this, there is a high prevalence of anxiety and depressions. So usually anxiety and depression, they leads to the suicidal tendencies. So that would be the last stage of the mental health crisis. Then limited access to the mental health care. So this is also one another important fact that we can see. So now let us try to look into the systematic statistical data that is available with us. So try to understand this, that we are going to read about the data and trends that are there in mental health. So just look at the facts and look at the data. So suicide statistics in India according to the ADSI report 2023. So there you can see that there was a total, if you see from 2023, total suicides in India were around 1,71,418. So this we have already discussed. And this suicidal numbers, if we translate into the compare with 2022, so it was a marginal rise of 0.3%. So this is one thing. So slightly the numbers have increased. But if you look at the suicide rate per 1 lakh population, so slightly there was a decline of 0.8%. Decline was there. But in absolute numbers, if you see, same is the increase. So that's one thing. Then what are the states with highest rates of suicide? So this is one another important thing. So states with highest rate of suicide. So look at this. So Andaman Nicobar Islands, then in northeast we have Sikkim, in the deep south we have Kerala. So Kerala, Sikkim and Andaman Nicobar Islands are the states with highest rates of suicides in India. So that is one thing. So the states with highest absolute numbers are the Maharashtra, Tamil Nadu, then Madhya Pradesh, Karnataka, West Bengal. So mostly these states are facing the issue of the absolute numbers. Okay, rate is different and absolute number. So number wise they are more because the population is also more in that. Are you getting that? Rate wise they are more. So that's one thing. So if you see from the perspective of these 5 states, so more than 40% of all suicidal deaths are happening from this. So from this point of view, we should think about how to curtail and how to just tackle this particular kind of emergency. We are calling it as emergency again and again because it is a kind of invisible emergency. No one knows that. Like imagine out of all the deaths, 40% are from these states, means like we should think and we should work upon such kind of causes behind that. So reasons behind that. So why it is happening like that. So that's all. So if you see from the perspective of gender distribution, so mostly men are the victims. So that is one another important thing. So friends, if you look from the perspective of the men and women, so usually females will be psychologically, they'll be very strong, whereas men will be psychologically weak. So physically men will be strong and psychologically men will be weak. In the similar fashion, psychologically women will be strong and physically women will be weak. So that's the that's one kind of thing that you have to remember. So in that fashion, men are the most victims to this mental health crisis. And then leading causes. What are the basic causes that are responsible for this kind of crisis or the mental health crisis? Now look at here. So if you look from the perspective of the causes, family problems marks highest percentage, where like mostly 31% or 31.9% of the issues are arising out of family. Then illness, 19%. Then you see substance abuse, that is like drug abuse. So it is around 7%. Then relationship or marriage related issues, 10%. So mostly if you see, be it could be family or be it could be marriage, one and the same. So most probably, so the issues that are surrounding family and marriage are contributing to more than 40 to 45% of the social these mental health issues. So we have to handle this thing. So if we are talking from the perspective of the tackling this particular issue, so we have to start it from the family. Let us try to understand how to tackle it. So for time being, you remember the causes. Okay. Now, if you look at the other aspects or other statistical information that is available with us, so look at this: farmer suicides and rural distress. So how many farmers are committing suicides, or what about the rural distress that is prevailing in rural India? So that is one another important thing. So friends, try to just have a look at this, that if you see from the perspective of the farmer deaths, so there were around, simply to say, so you can just see here that like mostly around 10,786 suicides were there in 2023. That means around 10,000 farmers have taken away their lives. So that's one thing. So these deaths or these suicides of farmers were majorly concentrated in Maharashtra and Karnataka regions. So that was one another important fact. So you have to remember. And then what was the long-term pattern of these suicidal deaths? So if you see from the perspective of the farmers, so over 1 lakh farmers have taken their lives since 2014. So in only 1 year, 10 lakh people, whereas since 2014, around 1 lakh people. So try to just catch this. So 1 lakh people have taken their lives. And then in between 1995 to 2015, so nearly 2,96,000 deaths, farmer deaths were linked to the various factors. So usually farmers will be taking some debts to go for the agricultural activities. So debt was one of the reason. And then market volatility. Market volatility means sometimes the demand of the goods, let's say for example tomatoes will be more, sometimes it will be less. When the less demand is there, so obviously the price will drop. So whenever such kind of issues are there, so again they will commit such kind of grave issues. Then institutional neglect. So this is one another thing. So governments or various organizations, they know that what's happening, but they won't handle those kind of things. So that is one another thing. Then look at the underlying causes. So first cause is like debt is one cause. So crop failure is one cause. Then inadequate price support is one another cause. Then the absence of the reliable social safety nets. So this is one another cause. So causes are very important for understanding. So these are all the causes. So when we know the causes, we have to address those issues. Are you getting that? So that's why we have to understand the causes. Then what are the, who are the invisible victims? Or there is a kind of hidden crisis that is there with respect to the rural distress or with respect to this farmer suicide. So if you look from the perspective of hidden crisis, so look at this, homemakers and caregivers, they are the invisible victims. And then particularly women, and they face rising rates of depression and domestic stress, but remain underrepresented in the official data. So if you see from the perspective of the data, friends, so mostly the data has been represented from the visible things, whereas there are so many invisible things, like think about the women. So women continues to work in the farms. So recently also we have understood the concept of feminization of the agriculture. So the number of females working in the agriculture is slightly increasing. So you have also had that statistics that around 80% of the rural women were working in the agricultural areas. On whole, like 48% of the Indian women are working in the agricultural arena. But what's happening? So their contribution is highly unrecognized and they are highly underpaid. So that's one thing. And moreover, this stress, look at all these things, they are facing the rising rates of depression as well as domestic stress. So this is not being depicted in the official data. So that's why we are calling it as hidden data or hidden crisis. So remember this. So this is one another aspect that you have to remember. So then if you look at the magnitude of the mental health burden throughout the India, so we have had a view or a glance of suicides, and we have had a glance of farmer suicides or rural distress. Now let us have a glance of entire India. Let us try to understand that. So if you look at the perspective of the total estimated burden of mental health crisis, so around 230 million Indians live with one or other sort of mental health disorders. So these mental health disorders are commonly like depression, anxiety, bipolar disorder, or like substance use conditions. So most of the youth are getting addicted to the drugs and substances. So this has to be curtailed. And then like anxiety, depression due to the professional pressures, due to the academic pressure, or due to societal pressures. So due to rise in the quarrels among the family. So such kind of issues are leading to this kind of mental health issues. So that's one thing. Then what about the treatment gap? So we are saying that around 230 million Indians are living with the mental health disorders, but how many of them are being treated, and what is the gap between the number of people receiving the treatment or not receiving the treatment? That's one thing. Now look at here, over 80% of the severely ill individuals receive no formal care. So this is one thing that we have to take care of, right, my dear friends, because nearly, if you see a range, the treatment gap range is that nearly around 70 to 92% of the people, that is on an average 80% of the people are not receiving the formal treatment. That means when you're not curing it at the stage of anxiety, or when you're not curing it at the stage of depression, then it definitely leads to the higher rate. That is, it may lead to suicidal tendencies. So people will commit mistakes in that particular instance. So this is the astonishing fact that we have to consider. And then next is like, what about the lifetime prevalence? So if you see from the perspective of prevalence, lifetime prevalence, 10.6% according to the national health data. So this is the prevalence of the mental health issues. And then what about the global comparison? If we compare India's data with the global comparison, so WHO estimates that India's suicide rate is 16.3% per 1 lakh people, so which is significantly higher than the global average. So that is one another important thing. So 16.3% suicidal rate is there in India when we compare with the global rate. So this is one another aspect that you have to remember. So friends, these are all nothing but various facts. So imagine as if that out of 140 billion, so 230 million Indians are having grave mental disorders. So this is very, very disturbing aspect. So we have to keep in mind. So now let's have a glance at what are the various legal as well as the governance related framework that is there with us with respect to mental health. So friends, you can see here we had an act called as Mental Health Care Act, which we have enacted in 2017. So this Mental Health Care Act provides and stipulates or contains some of the provisions. So look at the provisions. So Mental Health Care Act 2017, it guarantees the right to affordable quality mental health care. Affordable health care as well as the quality mental health care. This is one thing that this act has provided for us. And then it also decriminalizes suicide, and the act also mandates insurance coverage for psychiatric issues. So this is one another important thing. Then if you look from the perspective of the same act, so act upholds the patient dignity as well as the autonomy under the Article 21 of the Indian Constitution. So we have an article, that is Article 21, so which talks about right to life and personal liberty, which also stipulates that the dignity of the individual. So you might also have understood some other rights, like let's say right to die with the dignity. It's a part of Article 21. So in the similar fashion, patient dignity and autonomy has also been contained in Article 21 of the Indian Constitution. So I hope, so these were some of the aspects related to mental health here. Then what about the judicial reinforcement, or is there any judicial pronouncements related to mental health? So let's have a glance of that also. Now, if we look in a case that is Shukdev Saha versus the state of Andhra Pradesh, so in 2025, so we had a judgment, so where the High Court pronounced that the Supreme Court reaffirmed that the mental health as a fundamental right, compelling the state accountability. So that is one another important thing. So Supreme Court has reaffirmed mental health as a fundamental right. Are you getting, my dear friends? So as of now, so this is judicial pronouncement we can have. Now look at the other important thing, like we have district mental health program that we are running, DMHP. So this district medical health program is running or covering all across 767 districts of India, and it is expanding the access to outpatient services, that is OP services. And then not only this, like it is trying hard to just prevent the suicide, and then it is also trying to provide some sort of counseling. Are you getting it? So these are some of the governance related or legal frameworks that are available with us to tackle or to handle the crisis. Are you getting that? Now let us move forward. Despite of having all such kind of legal frameworks or governance related safeguards, so Telemanas, so there was another program called as Telemanas. I hope you might have heard Telemanas. So where psychological or like a psychological counseling will be given over the phones 24/7. Such kind of support would be there. So that is one another initiative that is being taken up by the government. So friends, now if you see from the perspective of the governance related aspects, although or despite having the legal governance and such kind of activities, but there are some systematic gaps that exists between the policy and implementation, and there are some shortages with respect to the manpower. So with respect to manpower, there is very less number of psychiatrists are available, nurses are available, so workforce is very less. So that's the first shortcome. So look at the other shortcomings or shortages are like a policy implementational gaps. So if you look from the perspective of this Mental Health Care Act, look at this first thing. So Mental Health Care Act 2017. So this Mental Health Care Act is mostly present or active or on the progressive on the paper, but it is not in the form of implementation. So if you see from the perspective of implementational perspective, this act is mostly, it is weak as well as it is inactive. So that's where one issue we have. Then if you look at the next implementation gap, so look at the National Suicide Prevention Strategy. So in 2022, we have created a strategy to handle this issue of suicide. So which is nothing but National Suicide Prevention Strategy. Are you getting it, viewers? So if you see from the perspective of it, so actually it aims for 10% reduction of the suicides. But what has happened? It also grossly failed, because we have saw a slight 0.3% of rise in the suicides from 2023 to 2022 to 2023. So that means this also has been failed in its aim. And then there is another initiative that is known as the Manodarpan initiative. So Manodarpan is nothing but it's a school-based support system for all the students. So this is also largely inactive. So this is another grave thing that we have to remember. Then look at the next thing. So postgraduate psychiatry departments and centers of the excellence. So if you see from India's governance point of view, so these centers of excellence have been sanctioned by the government, but they are under-resourced. The number of human resource power is very less, and there is that kind of issue. Then look at this mental health budget. So friends, this is the most important aspect. So if you look from the perspective of budget allocation, there should be sufficient budget that has to be addressed. But now what has happened? So budget is largely unspent. So that is one thing. So these are all nothing but various shortages, policy and implementational gaps that exists in between the things that we formulate and things we implement. So that's one thing that we have to remember, my dear friends. Now, look at what is the way forward to how we can overcome these issues. So where we have to focus now. So first and foremost thing what we have to do is that to tackle this invisible crisis, so our health emergency, so expand the mental health workforce. So first and foremost thing we have to increase the number of workforce that are working in the realm. So as I have told, there are so many shortages of the psychiatrists, doctors and these nurses and all such kind of mental health workforce. We have to just increase it. Then we have to just make counseling as a public infrastructure. So this is one another thing. So we should build counseling as a public infrastructure so that it can be available for all the people at all the time. So that is one thing. Then budget expansion to at least 5% of the total health spending. This is very, very, very important inclusion that we have to do it. So when we try to expand the budget, so the amount of budget, if that is more available, then usually we can raise the human resources, we can also raise the activities, and so that we can just handle this crisis efficiently. So this is one thing. And then anti-stigma campaigns and awareness campaigns. So there is one kind of stereotypic and misconception that if I express that I had some sort of psychological issues, I have some anxiety and I am facing the depression, such kind of issues, so I won't express it to others because there is a stigma that they will call me a psychopath or psychological person or mental person, so like that. So this anti-stigma campaign we have to run. So we have to demystify the stigmas that are there related to the mental health crisis. So people should be motivated to reach out. That's one thing. Then create a cascade-based national monitoring system. So we should create a national monitoring system so that we can handle this particular health emergency very appropriately. So this is what nothing but the way forward, and this is how we can overcome the issue of the invisible health emergency, my dear friends. So last but not the least, let's conclude the topic. So if you see from the perspective of India's mental health crisis, it is not just a mere health issue, but it's a moral, it's a social, as well as it's an economic emergency. So if human resources are not fit, so how the economy grows? So it becomes an economic issue, and it's a social issue, and it's a mental issue also, so moral issue also. So that is one thing. Then look at the next thing. So suicides remains the leading cause of death among the youth aged 15 to 29. So this is one another important aspect. So youth are committing suicides because of mental health issues. And in India particularly, when we see, so bears a disproportionate share of global female suicide deaths. So that is one another astonishing act or fact that we have to remember. Then untreated mental illness could cost over $1 trillion lost in the GDP. So this is one grave thing that we have to remember. So just look at this fact or the number, $1 trillion by 2030 means it's not a small thing. So we have to consider it as a grave aspect. So that's one thing. Then if you see from the perspective of the mental health crisis, every life lost is silenced voice. Every lost life is a silenced voice, and a broken family and a future cut short. So that's how we will be losing economically, socially, as well as morally. So that's why we have to handle this particular issue on efficiently on an urgent basis. So that's one thing, my dear friends. Now, before we close the discussion or before we end the discussion, let me give you a motivational capsule. So friends, those who are watching this particular session or the video or the discussion, so I would want to just give you a suggestion. So where what you have to do. So if you are facing some sort of psychological issues, be it could be the anxiety, be it could be the depression, be it could be some sort of other psychological issues. So what you have to do? So first, remember that, my dear friends, treat your mind like a garden. So treat your mind like a garden. So pull out all the weeds of the negative self-talk. So whatever the negative thoughts that are there with you, so first you pull out of all those things. Because if you are giving negative thoughts to your brain, usually same will be reflected, same outcomes will be reflected. So that's one thing. Then plant the seeds of self-care and plant and water them with the patience. So slightly infuse the positive thoughts into your brain and believe in yourself and make yourself, and you yourself can come out of such kind of aspects. So this is what I would want to advise you. And remember one final tagline, that mental health is not a weakness to hide it, rather it's a strength we should build together from the individual perspective as well as from the societal perspective. So we should remember it. So try to share your mental issues with your loved ones and closed people, and try to get out of such kind of things, and if required, reach out to the institutional support and get an appropriate counselings and all those things, and never ever commit some grave mistakes. So that's all for the day from my side, my dear friends. So this is what about the mental health crisis, that is an invisible health emergency that India is facing as of now. So friends, I'll meet you in another important session with another important topic. So till then, take care. Goodbye.